This is our future. Now, there's a couple of myths, and this is huge. Do you get less flexible as you age? No, you don't. Okay? Your joints always will remain flexible. The problem is, if you don't move it, it starts to decay. Movement is life to the joints. So the longer you keep it moving, I've never been that flexible. The longer you keep it moving, the more healthy those joints are. But joints are always being rebuilt. They're constantly being rebuilt. So we have a couple of myths. One, I must always warm up before stretching. No. Okay, you don't. What happens is just little bits of movement need to work. Okay, stretching circulates blood flow, allows faster healing. Stretching is a warm-up. Okay, you can work out a little bit and stretch some. I need to stretch for 10 minutes to get a good stretch. That's not true. What they're finding out, because what you're doing when you're stretching, you're changing what are called Golgi tendon apparatus. Now, you have a muscle attaches to a bone via a tendon. Inside of that tendon is a little machine, and it tells you how far the muscle should stretch. Have you ever seen workout guys that work out at the gym all the time? What do they walk around like? Like this? This is called sacrificing flexibility for strength. The muscles are increased in tone. Why? Because they're going for that. They're going for bulk strength, or they're going for bulked up, heavy-looking muscles. So they lose flexibility. What you're doing when you're stretching, you're changing that Golgi tendon apparatus. It's a machine that lives in the tendon that tells you how big or the tone of that muscle. So what's interesting is the more flexible or the more you move the joints are rebuilt. Now, have you ever heard of synovial fluid? In every joint, there's a lubricant. It's like WD-40. It's a clear, viscous fluid. It's beautiful. And it always is manufactured. Now, do me a favor. Take your arm. You're going to straighten it and bend it, and straighten it and bend it. Just 3 or 4 times. What you're doing right now, you're opening and closing the joint. Then you can put it down. What you did by opening and closing that joint, you increased and decreased pressure. Decreased pressure causes blood flow to increase in that joint. Blood flow increases the superfiltrate called synovial fluid, which is manufactured from blood into that joint space, and you rehydrated the cartilage. You actually regrew cartilage in your elbow just by doing that. Pretty neat, huh? I know. Can you regrow cartilage? Absolutely. But this stretching changes brain function. You change brain function, you change how the body functions. Does that make sense? Okay, now I'm going to run you through a series of slides because I want to drive home the importance of mobile joints. Now, I've showed you a couple of before and afters where you see arthritis reversed, disc spaces, you see it all around here. But understand, most people aren't educated like this. Most people think that disease can progress. They don't know that arthritis can be reversed and joints can be regrown. This is what a normal neck looks like. This one here, does this patient have forward head carriage? Yeah, is that head thrown forward? This is what this patient is like. So now she's going to have muscle spasm. This was taken in 1961 at a medical office. She has beginning grade 2 degeneration down there, just slightly off of the film. 2 years later, advancing degeneration. Did they correct the forward head carriage? No, that head's forward. It's still forward. It's still forward. It's not curved. It's down in this position. 2 years later. Okay, now this is 4 years after the first one. We're starting to see the bones. Remember, for every 1 inch the head's forward, the pressure on the disc doubles. So this woman has had 2.5 to 3 times the amount of pressure on those discs for at least 4 years. What's happening to the discs? They're being destroyed. Does this alter brain function? Does this alter immune system function? Does this increase her risk of cancer? I mean, this is a big deal. What's current therapy? I mean, we're talking 2009, not 40 years ago like this. It's 2009. What do you do for pain reliever? For pain?
What do we really do, or what are we?
Well, I know what everybody here does. They come here, we get it adjusted, we reshape, we reverse arthritis, and you eliminate the source of the pain. I'm talking about the people that are educated through television to buy the products. Yeah, and that's not effective. But that's 40 years ago.
How come it takes your headache away?
It eliminates and covers it up. Would morphine eliminate this woman's pain? Yep. Street heroin? Yep, just as well. The problem is, would it damage your liver? Is Excedrin and aspirin deadly to the kidneys? Is it the fourth leading cause of death in America, the leading cause of kidney disease? And is aspirin one of the leading causes of strokes? Yeah. So to take something poisonous to cover up a symptom isn't good.
Doctors have an aspirin a day.
Pure ignorance. Pure ignorance.
These people go to college for
Yes, I know.
15 years.
Yes, and it's pure ignorance. It is. In fact, if I was to tell you that, and this was just a few years ago, okay, take education and back it up with science and research. A few years ago, there was a group of people, and these were the most brilliant minds on the planet. They could prove to you, beyond a shadow of doubt, using empirical evidence and absolute scientific fact, that the world was flat. We found out different. You're supposed to say, good analogy, Doc. That really drove that point home, baby. Yeah, okay. No, but understand, their education, they're misinformed. They're not stupid, they're just ignorant. You asked me to work on a transmission? I don't know. You asked me to reverse arthritis? I know how to do that. Okay, they're ignorant about this. They're ignorant about nutrition. They're ignorant about the side effects of it because their education is poor. But this, you're looking at 15 years of destruction of bone that's progressive, that never needs to happen. It's ridiculous. This is absolutely what you need. There's a list of stretches on here that you can do to just stretch and move. But the biggest thing is to do it every day. You'll see there's stretches you can do on the computer. If you're typing with one hand, you could be stretching with the other. If you'll see me talking to someone, I'll be over here and I'll say, yep, yeah, that's what you need to do. Yeah, that's how you do it. I demonstrate stretches all day long, but also, since I'm using what are called flexors on the front, I'm always stretching those throughout the day when I'm talking to people. So you always take advantage of an opportunity to stretch. But this, to move well, eat well, and think well, that's the key to good health. This is what you need. Now, obviously proper nerve supply, but we know now that it's not just subluxation elimination. If you change how that body is shaped, do you change brain function? Hugely important. Oh, without it, you don't make it. Regular exercise. Why to detox yourself? Okay, proper nutrition. This means that by opening and closing these joints, you actually can rebuild cartilage. You can regrow cartilage. This we know for a fact. But if you have poor nutrition, you're eating McDonald's every day, you're not going to have the materials to rebuild. So proper nutrition means if God makes it, eat it. If it's synthetic or processed or microwave, you don't eat it. Sufficient rest. This means sleep at nighttime without TV. Okay? 15 minutes before you go to bed, you got to read. Okay, that resets your brain. And prayer and meditation. Is this scientific? Yeah, absolutely. Study after study after study shows that prayer and meditation will increase cell growth. It's hugely important. Hugely important.